Here at Sunnybrook, we have actually been involved with syndromic surveillance, monitoring people for many, many years in terms of looking for fever, cough, shortness of breath, and travel history. In terms of looking at Ebola, this actually just allows us an opportunity to review and enhance many of the precautions that we have in place on an everyday basis. You may not see the same level of suit that you have seen on television news reports. We are able to confine and contain a patient with Ebola in a much different way than people may have seen on television in developing countries. And certainly the level of contamination of the environment where our healthcare workers will be caring for these patients will be different. It allows us to use our current protective apparel in a better way, and it's protective apparel that all of our healthcare workers are familiar with, which is very, very important.
In August, I would say, is when we started really putting together some of our resource materials, the algorithm for identification of a possible case who may present to our hospital, some of the instructions about how to manage that case. It's really contact with those body fluids. So what we need to remember as an individual, whether it's someone in the community or a healthcare worker, is that I need to protect myself from my portal of entry into the body. So my mucous membranes, eyes, nose, mouth. So that's how a virus is able to enter the body. We've chosen a fluid-resistant gown to wear because of the concern about the infectiousness of the body fluids of an Ebola patient. And then in terms of the face protection, we've chosen a full face shield to offer a better protection for the entire face as opposed to just eye goggles, for example. This way we're protecting the entire face. So the other thing that's a little bit different is we're proposing a buddy system, and this is something that was used during SARS, so that if a healthcare worker is putting on their personal protective equipment, they have another healthcare worker, a buddy, who observes them and makes sure they're wearing every piece that they should be wearing.
We are ready here at Sunnybrook for the event if it does occur, and we have in place both policies, procedures, and a protective apparel for our staff.